What if I told you that you could start lowering your blood pressure today without a single pill? High blood pressure is one of the biggest silent killers out there, but the good news is that you can fight it naturally. Today, I'm giving you 5 proven ways in order to lower blood pressure without medication. These are the exact strategies that I give my patients every day, and the thing is, they actually work. But first, let's get on the same page about blood pressure. Your blood flows through tiny pipes known as arteries all throughout the body, and just like any water flowing through a pipe, there's pressure that gets built up on the inside. When your heart beats, it squeezes blood all throughout the body, and the pressure within the arteries carrying that oxygen-rich blood increases. When the heart squeezes and beats, this is known as the systolic blood pressure, which is the top number when looking at a blood pressure reading. When the heart relaxes or goes into diastole, that's known as the diastolic blood pressure, and that's what's seen on the bottom number. Now here's the scary part. Over time, blood pressure that's too high or too elevated actually damages the inside walls of those arteries. In fact, high blood pressure is responsible for half of all the heart attacks and strokes. Half. The number one best thing that you can possibly do in order to lower blood pressure naturally is to lose weight. For every 2.2 pounds or 1 kilogram of weight loss, your blood pressure number drops by 1 point. You don't need extreme weight loss. Minor changes really do go a long way. Losing just 10 pounds of body weight will drop your systolic blood pressure by 5 points. And this literally could be the difference between having high blood pressure and not having high blood pressure. Mechanistically, this makes sense. Remember when I talked about blood flowing through pipes and that analogy? Well, this is sort of true, but the difference between a lead pipe, like the plumbing in your house, versus arteries that we have within our bodies, our arteries adapt, expand, and contract based on our body's needs. For example, if I told you that my blood pressure is 180/90, you may look at me and say, wow, Mitchell, you really need to get that checked out. You're at risk of having a stroke. Please lower that as soon as possible, my man. You need help. But what if I told you that my blood pressure was that high because I tried to keep up running with my dog for the last 10 minutes, which no, she completely outpaced me? This changes things a lot. Our bodies are consistently changing and adapting to meet our physical needs, which drives our blood pressure higher at certain times. Now, how this concept ties into excess weight, if you have increased fat tissue surrounding these arteries, they are putting extra pressure on the arteries from the top, the sides, and the bottom. And these arteries with this extra pressure, they can't expand or contract as readily as they would otherwise need to be. The increased adipose tissue that's blocking the vessel will keep the pressure and shrink the size of the vessel over time. If the vessel shrinks, but the fluid within the vessel stays the same, that leads to increased pressures, and which is one of the reasons why losing weight is so crucial in order to help lower blood pressure naturally over time. I honestly see it with my patients every day. When they lose 10, 15, 20 pounds of weight and getting their BMIs lower, man, their blood pressures drop like that. Now, talking about weight loss in theory is all fun and games, but I know that losing weight is extremely challenging and can be very frustrating. What are the actual tactics that you can use in order to lose weight? This is really where the power of dietary changes comes into play. The weight loss equation is 80% food, 20% exercise. Keep those numbers locked in your head because we're going to talk about them in a couple of minutes. Now, you've probably heard the idea of just eating healthy from dozens of physicians and other friends and family members, but here's what eating healthy actually means. One of the most effective and well-studied eating patterns for reducing high blood pressure is known as the DASH diet. Following the DASH diet can decrease your systolic blood pressure by up to 6 points. When you combine that with weight loss, this leads to a decrease in blood pressure by 10, 15, 20, sometimes 25 points I've seen. For the DASH diet, think goodbye to all ultra-processed foods and focusing on whole cooked foods and getting rid of added sugars. This doesn't mean that you have to cut out fruits or even natural sugars like maple syrup or honey, but it's the added sugar that really is the culprit. Also, you want to focus on lean protein and you want to reduce salt intake overall. Now, here's the twist about salt. Most people think reducing salt is staying away from the salt shaker, but in actuality, 80% of all the salt that we consume in our diets is coming from processed foods and eating out, not the added salt that you put on your French fries. Even a healthy Mediterranean bowl from your favorite local place can contain an entire day's worth of salt. To put this in perspective, Finland figured this out decades ago. They cut their national intake of salt by 30%, and guess what happened? Blood pressure dropped at an average of 10 points, heart attacks and strokes decreased by 80%, and overall life expectancy went up. Now, here's the thing though, salt has had a little bit of critique as of late within the health literature, and although objectively cutting out salt can lower your blood pressure, there's something else to focus on our diets that's even more effective at getting to the root cause. This is sugar. Obtaining insulin sensitivity is the key in order to maintain regulation of salt within our bodies. Best thing that you can do in order to reduce blood pressure and lose weight at the same time is to get rid of and cut down the amount of processed sugar that you are eating in a day. If you take nothing else away from this video, focused on the added sugar, where those extra grams of sugar are coming in, and try your best to at least cut them in half or get rid of them completely. Some common ways sugar can sneak into our diets, and this is what I hear from patients all the time, things like soda, frappes, sweet tea, lemonade, all of those things contain high amounts of sugar, and if you cut that down and replace it with water or even flavored carbonated water, I really think this will help regulate both your blood pressure and help you with weight loss. The thing about liquid sugars is that they absorb so rapidly in the body that the liver can't keep up with how much sugar is being introduced in the body, that it leads to higher insulin levels. These increased insulin levels and how it interacts with a hormone called aldosterone is the key as to why you're reducing salt and you're not getting your blood pressure to be lowered. Now, I don't have time to break that concept down in this video, but I did another video explaining that. So if you're wondering why you're cutting out salt and you're not meeting your blood pressure goal, I'll put a link to that video in my description for you to check out later. What goes hand in hand with dietary changes to help facilitate weight loss is exercise. This is the other 20% of that equation that I talked about a couple of minutes ago. Did you know that specific types of exercises actually have a bigger impact on lowering your blood pressure overall? Now, doing a bunch of cardio is great, but guess what exercise actually lowered blood pressure the most based on a 2023 BMJ study with over 270 different trials? The answer is isometric exercises, things like planks and wall sits. These exercises dropped blood pressure on average by about 8 points. But don't worry, any exercise or movement is better than no movement at all. Whether it's walking, playing pickleball, yoga, dancing, it doesn't really matter. You just have to move your body. The good news about moving your body is that the recommendations from the American Heart Association say movement to be the pace or speed of a brisk walk, and you should aim to do that about 30 minutes a day, 5 days a week. Now, tactically, this can be implemented at night after dinner, as you can make this part of your after dinner routine where you have dinner with yourself or your family or your dog, and after you're done eating, you go for a brisk walk for about 30 minutes. This not only helps lose weight and also lower blood pressure, but it can also aid in digestion. Now, the last two tips that I'm talking about pair extremely well with the first three. The first one we're talking about is chronic stress. Now, chronic stress alone doesn't always raise blood pressure, although oftentimes it does. but rather it's the way that we cope with the stress that really leads to a raise in our blood pressures. Emotional eating, drinking more, smoking, these habits matter and can absolutely raise your blood pressure over time. If you do have a lot of stress in your life, try to find healthy outlets like journaling, going to the gym, swimming, decompressing with friends, anything that you can try to do to avoid the drinking, the smoking, the binge eating, things that can have a negative impact on your mental health and your blood pressure overall. Another thing that you can do to really de-stress yourself is cuddling with your cute little dog that you have. And speaking of, owning a dog has been linked to lower levels of blood pressure. I'm not kidding, guys. This is totally legit. In one small study, owning a dog and cuddling with that dog raised blood pressure more than one of the common blood pressure medications. So maybe it's time to rescue that dog you've been thinking about. Now, I can personally attest to this because I do own a dog. She's super cute to cuddle with. She's a Bichon, and she absolutely helps keep my blood pressure lower all the time. Now that you got some blueprints in your hands about how to lower blood pressure, what is that target that you should be shooting for? One of the most famous blood pressure trials, the SPRINT trial back about 10 years ago, showed that keeping blood pressure around 120/80, even 115/75, is much more beneficial for long-term outcomes and decreases mortality rather than having your blood pressure at around 140/90. So if you're looking for the sweet spot, I would say 120/80 is always the colloquial thing that we hear, but 115/75 is even better. Now, I know this was a lot of information and a lot to kind of take in, and it can seem a bit overwhelming, but honestly, guys, if you just take one of these points and start with one healthy habit, it really can go a long way. And honestly, even if you start off doing everything right, you may not get your blood pressure where it needs to go, or it may be starting off so high that blood pressure medicine is the right option for you at the start. And honestly, that is okay. If you found this video helpful, please send it to someone that you care about. Let's raise awareness of the importance of having all of our blood pressures lowered so that we can live longer and healthier lives together. Remember that your health is your superpower. My name is Dr. Rice, and I will catch you all on the next one.